If you're a healthcare professional wanting to know how to treat spider veins on the face, you're in the right place. There are 5 essential facts about spider veins on the face that you as a doctor or nurse must know before you make your decision about treating them. I will cover the following. What are they? What do they look like? What causes them? When are they a problem and how can they be treated? And be sure to stick around to the end when I will tell you the #1 mistake healthcare professionals make when adding spider veins on the face to the list of conditions that they treat. And it's an expensive one, believe you me. So what are they? Spider veins on the face are vessels in the skin up to 1 millimetre in size, also known as thread veins or broken veins. And the medical term for these is telangiectasia. What do they look like? Well, spider veins have a typical appearance and most people instantly recognise them. They can occur anywhere on the face, but they're frequently found on the chin, cheeks and nose. What causes them? For most people, we don't know why they get them. They're called idiopathic in that situation. However, sun exposure, rosacea, liver disease, drinking too much alcohol, smoking and sometimes steroid creams can be aggravating factors. They really can affect a person's confidence and self-esteem, which is why being able to offer an effective solution to your patients and clients is so rewarding, both professionally and financially, I might add. When are spider veins a problem? In some cases, spider veins can be caused by rosacea. These patients need help from a dermatologist or at least a GP with a specialist training. For most people, the appearance of the spider veins causes embarrassment, poor self-esteem and lack of confidence. And this is often the motivation for seeking help. How can spider veins on the face be treated? Well, there's a simple, safe and effective treatment for spider veins on the face, and it's called shortwave diathermy. A medical electrical current is applied to the spider vein through a tiny sterile needle. This closes and seals the blood vessel instantly, and the blood vessel is absorbed and disappears over time. If you've never heard about shortwave diathermy and you want to know more, I have a free guide that you can download. Check out the link in the description box below. Now, at the beginning I said I would tell you the #1 mistake doctors and nurses make when treating spider veins on the face. And it's thinking that laser or IPL is the only treatment for these spider veins on the face. Some companies actually market these devices to aesthetic doctors and nurses, promoting them as the only effective treatment. Well, if you've bought an expensive laser machine or a coagulation machine for spider veins on the face, the bad news is that shortwave diathermy is a very safe and effective, as well as very cost-effective way to treat 98% of spider veins on the chin, cheeks and nose. In fact, the equipment I use costs less than £900. It doesn't require expensive cooling devices and it doesn't require expensive servicing. It's probably just as effective as equipment costing 20 to 30 times more. So please don't make this expensive mistake. The equipment I use in my training courses is the Epil 100. And you can find out more about it in the links below. Now, if you found this information valuable, please consider hitting the like button. It really does help my channel, and check out all the links in the description box below. Why not leave me a comment or a question? I look forward to reading all of these, and I promise I'll get back to you as soon as I can. I hope to see you again, so don't forget to hit the subscribe button, and that way you won't miss my next video. Thank you for staying to the end, and thank you for watching.